Let's talk testosterone. As a middle-aged guy, one of the things that has become incredibly popular over the last few years is testosterone. There are legions of influencers out there telling men that the secret to feeling better, looking good, performing well, and aging healthfully is to hop on TRT or testosterone replacement therapy. But the question is, are they right? Or is this just another fad with potentially serious consequences? Hey there, my name is Dr. Tim Gersmar, and I help middle-aged guys to recover their mojo so that they can feel good, look good, perform well, and age healthfully. So let's talk testosterone. Ultimately, we need to answer three questions. Is testosterone the fountain of youth for middle-aged guys and the key to getting your mojo back again? Two, do all middle-aged and older guys need to get on TRT? And three, is testosterone safe and effective, or is it dangerous? If we want to tackle this question and avoid all the hype and BS and fads, we need to break things down and explore this issue properly. To make sure we're on the same page, let's start with a super quick what is testosterone? And don't worry, we're not going to go into biochemistry and have an endocrinology lecture here. In the simplest terms, testosterone is the male hormone. Now let's be clear, every human being has testosterone. It's also important for females as well, but that's not our focus here today. Testosterone is the major hormone that transforms little boys into men. When we're little kids, we have very little testosterone, and when we go through puberty and into young adulthood, we should have high levels of testosterone. And then, on average, as we get older, our testosterone levels decline. So roughly speaking, we can simplify and divide the effects of testosterone into four categories. The first are male characteristics, like a deeper voice, hair growth on your face and your body, and sadly, hair loss on your head. Now that's a topic for another time. Second, muscle mass. The third, mood and mental function. And fourth, sexual function. Testosterone affects virtually everything in the human body, from the top of our head to the bottom of our feet. And influencers are correct that there are many men out there who are suffering with low testosterone, who don't know that that low testosterone is at the root of what's going on for them, or who aren't being taken seriously by their doctors who don't know how to effectively diagnose and treat low testosterone. So, what are the symptoms of low testosterone? Unfortunately, the major symptoms are really vague. They include things like 1, low energy, being tired all the time. 2, low motivation and drive to do and accomplish things, a lack of pleasure in life, essentially depression. For some guys, it looks more like anxiety and trouble concentrating, and I also call this the cranky old man syndrome. Third, decreasing muscle mass and increasing fat gain, a lack of results at the gym or with an exercise program. And 4, low or non-existent sex drive, and at very low levels, erectile dysfunction. Problem though, as you can guess, is there are a lot of possible reasons why you can be tired and cranky and have a low libido and aren't getting good results at the gym. Testosterone is not the magic fix for all of these issues. And even though there are pill mills out there who will prescribe you testosterone if you simply pay them, and there are of course black market sources that a lot of guys end up going to, the truth is testosterone is not magic. And in fact, when you don't need it, at best it will do nothing, and at worst, it's going to cause some significant side effects for you. But it's absolutely true that there are a lot of guys out there who have these symptoms, they aren't being checked by their doctors, who aren't being taken seriously, who instead are just given things like antidepressants for their mood and boner pills for their erectile dysfunction, and they end up just living low quality lives because their testosterone levels are too low. Now we need to answer the question, does testosterone always decline as we age? Well, when we look across the entire population and across time, it's absolutely true that we see that testosterone levels do go down as we age. Your testosterone is probably lower when you're 80 than when you're 60 or 40 or 20, but we also know that that is not true for every single man. And here's another important piece. The absolute level of your testosterone, as measured on a blood test, is not the single most important thing. You're going to see a lot of influencers out there talking about their levels and how you have to have your testosterone at this level or that level. It's usually at the high end of the range in order to feel good, to look good, to perform well, and to age healthfully. The issue, that's just not right. Normal is going to be different for different men. what might be considered low for one man may be 100% normal for another guy. In fact, they've taken testosterone levels from young, healthy, buff athletes, the kind of guys you expect their levels to just be sky high, and some of them are, but many of them are completely average. And some of them are actually on the low side of normal. And again, these are guys who are looking and feeling fantastic. So when we talk testosterone and having your mojo, it has to include a combination of one, how a guy's feeling, and two, what his levels look like. And even if you take a test and on that test your testosterone is at the lower end of normal, but you feel great, that does not mean you have a problem and you must start TRT. That could be completely normal for you. Okay, so we're trying to answer the question, does testosterone always go down for guys as they get older? So does that mean all older guys need TRT? And the short answer is no. Not every middle-aged guy is going to have low testosterone, and not every middle-aged guy is going to need to get on TRT. But it's true that some absolutely do. And in the future, we're going to talk more about how there's not just one type of testosterone therapy, there are actually three. So I do hope you'll join me for that one. All right, let's wrap things up with today's takeaways. First, testosterone is very important for everyone, but especially guys. Low testosterone can absolutely tank your quality of life, and evidence suggests it might shorten it as well. 3, testosterone tends to decrease as we get older, but again, that's not true for every guy. And 4, the symptoms of low testosterone are pretty vague, leading most doctors, including many endocrinologists who specialize in hormones, to be really bad at testosterone therapy. Now, testosterone is not the fountain of youth, nor is it a mandatory treatment that every middle-aged guy is going to need to get his mojo back again. Not every middle-aged guy who's feeling lousy and fatter than they want to be, depressed or anxious, and not performing well is going to need TRT. But for some guys, it is critically important and a key piece of living that high-quality life we all want. In our next video, we'll continue the discussion of testosterone and talk about the 3 types of testosterone therapy so we can help you understand as a middle-aged guy if testosterone treatment is the right call for you. In the future, we'll also talk about testing for testosterone as well as other important pieces if you're thinking about using it. And as always, we'll continue to break down a lot of the myths, the fads, and the bad information out there so that you can focus on doing the things that are truly going to help you to feel better, look better, perform well, and age healthfully as a middle-aged man. I hope you'll join me. All right, guys. Until then, take care.